At this busy Birmingham practice, the National Health Service has a distinctly international clientele. Patient numbers boosted by visitors, overseas students, migrant workers. And here most seem to agree it makes sense for foreigners to help pay their way.
I have a lot of family abroad myself as well, but if they were to while visiting me over in England, they were to fall ill, again, depending upon the circumstances, I myself would hold my hands up and be able to offer to pay for the services that they need.
When we go to their country, we have to pay for our medicals as well, so it should be exactly the same for them.
But doctors are uneasy with the thought of checking not just the pulse but the immigration status of any patient. And GPs have issued a stark warning that any fee could deter people from getting checked, putting not just themselves but the public at risk.
We certainly don't want people with infectious diseases wandering around the streets of London, infecting others. We also don't want people becoming so unwell from what might be a minor problem and ending up costing a lot more money down track and actually will cost us a lot more money.
But the government insists reform is needed to curb health tourism, to stop people coming to Britain to access care. Under the plans, any non-EU student or worker with a visa for 6 months or more would pay £200 a year for health service access. Short-term visitors would also have to pay to see a GP. Emergency patients and those with infectious diseases would be exempted. The Department of Health has no exact figures on what it costs to treat foreign visitors. Estimates range from £50 to £200 million a year. That may be a small fraction of the overall NHS budget, but ministers still want it back.
If I go on holiday in Japan, I don't expect to get free access to a doctor there. And so we're saying that's one of the things we need to review. Another thing we're looking at is whether if you're, for example, someone coming to study in the UK for a few years, if you were going to study in America, you would have to take out private health insurance. If you were going to Australia, you would have to pay a levy.
But the move's been condemned as a political gimmick, an easy headline grabber by many who work with immigrants. Critics who say that health tourism is a myth.
This seems to us as a big political sledgehammer that's being used to crack a very small nut. More to the point, these proposals potentially will cause very bad health outcomes for individuals and for communities, and probably will cost the NHS much more money down the line.
And for a government committed to slashing red tape, the big conundrum of the bureaucracy required to institute such changes. Savings in one corner may bring major cost in another. Michelle Clifford, Sky News.